I think having that open conversation, and even you have the ability to make a list for the family, or there's a way to document what everything the resident is on. And, just keeping open communication and asking them how they're feeling, what they're doing in the facility on a day-to-day basis.
Hey out there, welcome back to the Nursing Home Abuse Podcast. My name is Rob. I will be your host for this episode. We are talking today about reducing the likelihood of medication errors during that small window of when the nursing home resident is first admitted to the nursing home. So we're going to be talking about the process by which the residents' medications and their prescriptions actually make it into the building, and from there, how it's entered into the electronic medical record system and all that kind of stuff, and what we can do to reduce the likelihood that there's going to be problems with that. But we're not doing that alone. We have the fantastic Shanna Rittberg on the show with us to talk about that a little bit later on. But before we get into that, it is time for the nursing home regulation question of the week. And as always, it is your opportunity to win a Nursing Home Abuse Podcast coffee mug. It is the perfect way to ingest your morning coffee each day. Do you want a chance to win? Chance isn't even the right word at this point. Do you want it? You can have it. It's yours. I have boxes of these at my house. Please get one. Okay. There's no chance involved. If you participate in any way, you're probably going to get one. So how do you do that? You go to our TikTok, which is at Justice for Residents on the TikTok. You're going to find the thumbnail that has Ricky Henderson on it. Ricky Henderson being a baseball player. So just look for a baseball player. He's probably going to be wearing green because I think Gene, if you're going to Google images of Ricky Henderson, it's probably going to be when he played for the Oakland A's, but you might get him on the Yankees. I don't know. Look for a baseball player. Find a baseball player. Post your answer to the nursing home regulation question of the week, as well as your favorite sports legend. Doesn't have to be baseball. It can be anything. It could be Mary Lou Retton. It could be Billie Jean King. It could be, I don't know. These are all references if you are over 40 years old. Who's a new person? Who's the guy that's dating Taylor Swift? That guy. You can be that guy if you want it to be. Favorite sports legend and your answer on our TikTok. One lucky winner chosen at random. But again, it's not random. If you participate, you're probably going to win. The winners are announced on Sundays on TikTok and our website. If there are any, we'll see. And then it's shipped at the end of the month. You'll be drinking hot coffee or cocoa, whatever you want, out of your Nursing Home Abuse Podcast mug. All right, now time for the question. Under 42 CFR 483.35, which requires nursing homes to have sufficient nursing staff, what key factors must be considered when determining the number of staff at any given time? Is it A, census, B, census budget and market rates for nursing, or C, census and resident acuity? And that answer is C. In order to have sufficient staff, the nursing home must analyze the resident census as well as the resident acuity and then staff appropriately. All right, let's get into the meat and potatoes of the episode, everybody. So as I mentioned before, we are having an excellent conversation with Shanna Rittberg. Shanna Rittberg is a dedicated neurology nurse practitioner with 14 years of experience and a nursing career spanning since 2006. Since 2021, she has also served as a legal nurse consultant, bringing her medical expertise to legal cases. Her combined clinical and legal knowledge allows her to provide valuable insights in both healthcare and litigation. We are so happy to have her on the show. Shanna, welcome to the show.
Thank you. Nice to be here.
Now, I've had a few episodes dealing with medication errors in nursing homes and how they typically occur, but I've never had one focus exclusively on the process of admission, how we go from maybe acute care facility or maybe the home to a nursing home, and that handoff, and how medication errors can happen in that time. So the kind of the first question, just to kind of set the table for everybody, is what are we talking about when we say the admission process or admission? Like, what is that time frame?
Yeah, I mean, honestly, the admission process is right when the person walks through the door. And typically, what I find is nursing homes allow about a 72-hour window for that. I think it's to give the staff time to kind of get them acclimated and get everything done. But I really, the responsibility is right when the person walks through the door, honestly.
What is the process? And for the so guys, for this question, let's just assume that the resident is entering a nursing home from a hospital. So, what is typically the process by which the nursing home receives the prescriptions?
Yeah, I mean, that's the thing is that all the nursing homes have such a different process, but typically what we're seeing is that there's a case manager involved and that there's medication lists being sent to us. And some facilities, in my experience, have pharmacists on staff that will call other pharmacies to verify medications, especially if the patient is coming from the home. But in hospital settings, what we see more frequently is that a case manager is sending a list of medications from the inpatient. And I think that that's kind of where the wires get a little bit crossed.
So, if I understand, so typically it's typical, right? As you mentioned, the policies and procedures for all these nursing homes are different in terms of how they receive medication lists and prescriptions. But typically, is it going to be a sheet of paper that gets given to the resident and the resident goes to the nursing home? Is it like via whatever the electronic medical records that the hospital has, they send it over to the nursing home? Typically, like, how is it physically getting to the nursing home, that prescription list?
Honestly, it's usually a piece of paper coming from either, if the person is coming from a facility, it's typically a piece of paper because a lot of the electronic health records don't necessarily talk to one another. And, I think that we take that for granted. If you work in a big facility and you have a high level electronic health record, you have that ability to cross reference things. But in nursing homes, they don't always have the revenue to afford those high level electronic health systems. So they're still documenting electronically, but their facility doesn't have the ability to talk to the electronic. So what we see are pieces of paper. And if they're coming from the home, in my experience, we allow the residents to bring their medications. We want to see the bottles that they have. We tell them to bring their supplements as well. But if they're coming from a hospital, especially, it's a piece of paper.
So then I would imagine that the nursing home then would upload, scan, or just literally physically, somebody's physically typing that information into their own electronic medical record system and then going from there.
It's typically entering the data manually. The papers do get scanned in, but the medications also have to be manually entered so that now that facility it can talk to one another. It can have and for nursing to see it, for pharmacy to see it, anyone that's involved can see it in that facility. It has to be manually entered.
Now we've talked a little bit about the actual, like, the document that tells you the medications. What about the medications themselves? So, like, if you still have, Miss Johnson has a certain amount of antibiotics, that's still being, administered every day. How do those pills get to the nursing home, if at all, from the hospital or from the home?
Well, if they're coming from the hospital, we verify that we have that medication before we accept anybody because we don't want any lapses in that medication. And if they're coming from the home and we're not like that medication is not available to us, we'll ask them to bring it with them.
And then I guess it's the same thing. It gets inventoried once it makes it to the nursing.
Absolutely. It gets taken away from the resident.
Right.
We hold that medication. Absolutely.
So we have a piece of paper, we have bottles, they get inventory, they get uploaded into the nursing home's own system. And from my understanding, from what we've just described, is that that should happen typically within the first 72 hours.
Yeah.
All right, now we've kind of set the table. Where are you seeing the most amount of problems and medication errors in that process?
Well, I think the two biggest things are missing a home med or entering in the wrong dose based on the way that it appears on the paper. It looks like it's one dose, but really it's double that or it's half of that. So we see medication errors from that. Definitely, I think the manual input. And also, if they're coming from home, forgetting one.
I see. So what is the what can the average nurse who's, the one that's admitting the resident, doing their first baseline care plan, all that stuff, receiving the resident, what can he or she do to reduce those issues?
I think it's very difficult for nursing in general because, especially if the facility is short staffed, but the best thing for them to do is if the resident has family is to kind of have a group conversation because in my experience, the more people you involve in care, kind of the more ears you have. And someone will say, oh, but what about this? And what about that? And well, didn't somebody give you this for that? And it's more of a conversation. I mean, it's impossible. It's hard because people take so much medication and just medicine alone is like a full-time job. And it's very difficult for us to expect people in their lowest time, in their sickest time to remember everything. And so like if the resident doesn't remember that they take it, also the nurses could ask them questions and it could just be a miss. And or if the medication somehow didn't make it to that piece of paper from the facility that they came from. I mean, there's nothing that you can do about it except try and make it better the next time. But having open communication, especially if the resident has family, is like the best communication, the best way to like talk to the people about it. I mean, I don't know what else nurses can do. They're kind of already so overburdened.
You have a family in front of you, and they're admitting their loved one into a nursing home. The loved one has, the 15, just get the litany of medications. What are some of the things, what would be a couple of the things that you would recommend that they do in order to minimize that medication error risk at the beginning?
You mean like to discuss it with the family so that the family can assist
Mhm.
to help? Honestly, I think having that open conversation, and even if you have the ability to make a list for the family, or there's a way to document what everything the resident is on, and just keeping open communication and asking them how they're feeling, what they're doing in the facility on a day-to-day basis, and not really making it just about medications. But if they're on important medications, like obviously with my neurology background, I'm always thinking anti-epileptics. It's like you have to really make sure that they're getting their medications on a scheduled time and just asking them to check in with their family members to make sure. And if there's an issue or a discrepancy, bringing it up with the staff. Absolutely.
So I might have missed this, and I apologize. But is there typically an individual, if there's no pharmacist on staff at the nursing home, okay, is there typically one position or title that is responsible for receiving the medication or receiving the medication list for every resident, or is it just shift by shift, you know, somebody does something like that.
And facility by facility.
Mm-hmm.
So I can almost guarantee that if you asked 100 nurses that worked at nursing home what their process was, it would almost, in my opinion, be different each time.
Mm-hmm.
And obviously, you really want the nurse that is receiving that patient to take full control of what's going on. But that is almost impossible to predict if that's going to be able to happen. And there are pharmacists at facilities, and I think that that is probably the best case scenario, but it is usually the nurses. It's always the nurses that are responsible for it. And it's a big job for them. It really is a big job to not only admit the patient, do the assessment, but then make sure that, especially if they're coming from home and we need to keep their home medications, to then make sure that they get into the appropriate place so that the next shift has access to them.
And I think you might have mentioned this before, but forgive me. So, the idea of verification. So you have a resident that is being admitted from home, and they hand you, the 3 or 4 bottles of pills or whatever. The nursing home is not taking their word that this is the appropriate things for them. Like, is there any type of verification process? And if there is, what is it typically?
Yeah, we look at the bottles and we verify with the pharmacy that these are recent medications and, that the doctors that are prescribing them have like recently put in this prescription for them. And if there are any discrepancies, we definitely, that is a big responsibility. You can't just take someone's word. You have to verify it in some way, shape, or form.
And I guess when the resident is coming from the hospital and hands the nurse, the admitting nurse, the prescription list, that speaks for itself. Like, or is there still typically a verification process? You're still calling the pharmacies, even though the person admitted from a hospital.
No, if the person's coming from a hospital, I mean, they've been on those medications, so we have to take their word. Like, we have to just say, like, this is what they've been on
Sure.
and go from there.
Well, Shayna, we really very much appreciate you coming on the show and sharing your knowledge with us.
Thank you. I really had a great time here.
Well, everybody, I hope that you found that episode educational. Again, I apologize about the audio. Hopefully, Gene was able to clean that up, but I forgot to turn the mic on. That happens sometimes, even though I have a little cheat sheet of things that I need to do for every episode. But to err is human, as they say. So if you have any ideas for topics that you would like for me to talk about, please let me know that. If you have any ideas for people that you want me to talk to, please let me know that as well. New episodes of the Nursing Home Abuse Podcast come out every Monday. Please, please, please tell me that you want a coffee mug. I got to get these things out of my house. So enter to win them. TikTok, @Justice for Residents, that kind of thing. And with that, folks, with that pitiful plea, we'll see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes for now are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.